Doctor, you mentioned having an open mind too as part of your integrative practice. How much of that do you ask of your patients as well? Because when we have a condition, we want to go in, get something, and get out and get it taken care of. But how much do you ask of your patients to be open-minded about different therapies as well?
Oh, it's very important, and it's very tricky, especially in cancer, because people are very charged. We have to gauge where they are in their philosophies. There are guiding questions we ask people, how hard are you willing to work to get better? What are your priorities in life? What were your priorities before you were diagnosed with cancer, and what they are after you were diagnosed? And most important, if your cancer went away, what would you do differently? We want to see a change. And then we work within the parameters of the patient, because if the doctor is open-minded enough, then we know that the restriction will come from the patient. If the doctor is tighter than the patient, the restriction is coming from the doctor. And that's a big issue. I often say that one of the big flaws with doctors is that we stand in the way of the healing of our patients through our skepticism. We learn in medical school that certain cancer, a certain stage, is terminal, or they will survive for 1 year. So we decide they're going to live for 1 year. We're not open to the idea that they can live longer. Hey, something is wrong. How come they are living longer? That's part of an open mind. Leaving the possibility for things to happen. And we introduce this in the clinical or to the patients, but not in a false way. What I tell patients is every patient can be a miracle. Not everybody is going to be a miracle, but everybody can be a miracle. And the job, the challenge for the holistic, well-trained doctor who is a healer is to find the door to create the miracle. There are always doors. We just have to see them, and they're usually not where we look. They're not so obvious.